The female reproductive system. External genitalia. The vulva refers to those parts that are outwardly visible. This includes mons pubis, labia majora, labia minora, clitoris, urethral opening, vaginal opening, and individual differences in size, coloration, shape of external genitalia are common. Here is a sample image of female's external genitalia. Mons pubis has triangular mound of fatty tissues that covers the pubic bone. It protects the pubic symphysis, and during adolescence, sex hormones trigger the growth of pubic hair on the mons pubis. Hair varies in coarseness, curliness, amount, color, and thickness. Labia majora, referred to as the outer lips, and they have a darker pigmentations. The functions of labia majora are: they protect the urethral openings, are covered with hair and sebaceous glands, tend to be smooth, moist, and hairless, becomes flaccid with age and after childbirth.
Labia minora, referred to as the quote-unquote inner lips, made up of erectile, connective tissue that darkens and swells during sexual arousal, located inside the labia majora. They are more sensitive and responsive to touch than the labia majora. The labia minora tightens during intercourse. Clitoris, highly sensitive organ composed of nerves, blood vessels, and erectile tissue, located under the prepuce. It is made up of shaft and a glans, becomes engorged with blood during sexual stimulation. Key to sexual pleasure for most women. Urethral opening is located directly below clitoris. Vaginal opening introitus. Opening may be covered by a thin sheath called the hymen. Using the presence of an intact hymen for determining virginity is erroneous. Some women are born without hymens. The hymens can be perforated by many different events. Perineum, the muscle and the tissue located between the vaginal opening and the anal canal. It supports and surrounds the lower parts of the urinary and digestive tracts. The perineum contains an abundance of nerve endings that make it sensitive to touch. The episiotomy is an incision of the perineum used during childbirth for widening the vaginal opening. Internal genitalia. The internal genitalia consist of the vagina, cervix, uterus, fallopian tubes, and ovaries.
Here is a sample image of a female's internal genitalia. Vagina. The vagina connects the cervix to the external genitals. It is located between the bladder and rectum. It functions as a passageway for the menstrual flow, for uterine secretions to pass down through the introitus, and as the birth canal during labor. With the help of two Bartholin glands, becomes lubricated during sexual intercourse. Cervix. The cervix connects to the uterus to the vagina. It has a small cervical opening to the vagina. This acts as a safety precautions against foreign bodies entering the uterus. During childbirth, the cervix dilates to accommodate the passage of the fetus. This dilation is a sign that labor has begun. Uterus, commonly referred to as the womb, a pear-shaped organ about the size of a clenched fist. It is made up of endometrium, myometrium, and perimetrium. Consists of blood-enriched tissues that slew off each month during menstrual cycle. The powerful muscles of the uterus expand to accommodate a growing fetus and push it through the birth canal. Fallopian tubes serve as a pathway for the ovum to the uterus, are the site of fertilization by the male sperm, often referred to as the oviducts or uterine tubes. Fertilized eggs takes approximately 6 to 10 days to travel through the fallopian tube to implant in the uterine lining. Here is a sample image of a woman's oviducts. Ovaries. The female glands are sex glands. They develop and expel an ovum each month. A woman is born with approximately 400,000 immature egg cells called follicles. During a lifetime, a woman releases at 400 to 500 fully matured eggs for fertilization. The follicles in the ovaries produce the female sex hormones. These are progesterones and estrogens. These hormones prepare the uterus for implantation of the fertilized eggs. Breasts. Organs of sexual arousal contain mammary glands, consists of connective tissue that serves as support. Each breast contains 15 to 25 clusters called lobes. Each lobule is connected by ducts that open into the nipples. The nipples are made up of erectile tissue. The pigmented around the nipples are called the areola. Breast size is determined primarily by heredity. Size also depends on the existing fat and glandular tissue. Breasts may exhibit cyclical changes, including increased swelling and tenderness prior to menstruation. Benign breast changes refer to fibrocystic disease, lumps or masses that are non-cancerous. Here is a sample image of a woman's breast with its labels. Women need to examine their breast monthly through breast self-examination. This is a proactive approach to detect a possible breast cancer, a supplement to clinical exams and mammography. Best time for breast self-examination is a week after menstruation. Here is a sample image of a breast self-exam. Menstruation. The onset of menstruation signals the bodily changes that transform a female body. Average age is 12 years old. Amount of bleeding varies from woman to woman. Explosion of blood clots. Blood color can vary from bright red to dark maroon. Usually occurs every 25 to 32 days. Women can experience fluid retention, cramping, mood swings, weight gain, breast tenderness, diarrhea, and constipation. Sex hormones. Follicle-stimulating hormone and luteinizing hormone, which signals ovulation. Estrogen produced throughout the menstrual cycle, while progesterone produced during second half of cycle. It contributes to the thickening of the endometrium, which is shed during menstrual phase if fertilizations do not take place. Note: both FHS and LH are produced in the pituitary gland. Both estrogen and progesterone are produced by the follicles in the ovaries. Dysmenorrhea, a painful menstrual cramps, painful menses without evidence of a physical abnormality, believed to be normal body response to uterine contractions. Other symptoms are nausea, vomiting, gastrointestinal disturbance, and fainting. Prostaglandins causes forceful, frequent uterine contractions called cramps, fibroids, polyps, IUD, PID, or endometriosis.